This is a condition of limbal dermoid. It also called as corneal dermoid or epipulbar dermoid. This is an benign congenital tumor which mostly occurs at the limbus, and it appears solid white masses firmly attached to the cornea. This dermoid can contain collagenous connective tissue, hair, skin, fat, and sebaceous glands lined by epidermal epithelium. This limbal dermoid is basically associated with some conditions like Holden-Hess syndrome, ring dermoid syndrome, epidermal nevus syndrome, scleral or corneal staphyloma, aniridia, aphakia, cataract, microphthalmia, coloboma of upper eyelid, lacrimal stenosis, nevus filamus, neurofibromatosis, Treacher's Collins syndrome, and Dwan syndrome. Symptoms of this limbal dermoid: decreased vision due to induced astigmatism, foreign body sensation, and cosmetic problem of visible large mass. And the signs of this limbal dermoid: the first one is history of systemic conditions which are associated with this dermoid, and the second one is astigmatism. Since this condition is congenital, they can present with or without amblyopia. Third one is dermoid will be in dome shape with visible hair follicles and cilia, and with or without vascularization. Diagnosis of this condition: anterior segment ultrasound biomicroscopy and anterior segment OCT can be done to evaluate the depth of dermoid and corneal descendant membrane status. Differential diagnosis of this limbal dermoid can be Beatus anomaly, juvenile xanthogranuloma, sclerocornea, corneal scar, pterygium, foreign body granuloma. Management of this condition: this dermoid will be managed only by removing surgically, and after removing it, glasses will be prescribed for the induced astigmatism.